Hi, I'm Dr. Bart Ketover. I'm a certified ophthalmologist at the Milauskas Eye Institute and would love to talk to you about cataract surgery. Well, I think Milauskas Eye Institute is the top cataract surgery institute anywhere in our area, and the reason is, number one, we have our own outpatient eye surgery center, and all we do there is cataract surgery, and the staff is trained only to do cataract surgery. It's a very sterile and safe environment. Number two, we have top of the line, the best equipment that's available for cataract surgery, and we have very well trained, experienced physicians who do the cataract surgery. The causes of cataracts are usually just aging of the lens of the eye. There are some predisposing factors. Diabetics more commonly get cataracts, sun exposure, certain medications, but by and large it's just an aging and fogginess of the lens of the eye. Cataracts do run in families, but it's not that specific. It's mostly just an aging and fogginess of the lens that's really out of your control. Cataracts are more commonly appearing as we age. However, we do cataract surgery in young people as well. There's really no age limit. It is certainly more common as the decades increase. The symptoms that cataracts cause are very simple and straightforward. Your vision blurs. The lens of the eye, which the focusing is done through, thickens, fogs, hazes, discolors, and so it's kind of like looking through a camera lens where the lens is getting greasy and foggy and scratched up. So no matter how well you focus the lens, the picture's still blurry because the lens of the eye is now unclear and hard to see through. And that's why it has to be removed when the patient feels like they need to see better. It's not likely. There are very few eye problems that cause headaches. Sometimes if you're straining a lot to try to see better and squinting a lot, it might predispose you to some around the eye, forehead kind of headaches, but in general, it's basically just a visual problem. Cataracts can progress to the point where you have very little or no vision, but they're always fixable. You can always remove the cataract no matter how thick it is and return the vision. So it doesn't cause permanent blindness, but it can cause progressive visual loss to the point that you can't function if you don't take care of it. The most common cause of double vision is an inability for the two eyes to function together. However, a single eye can get double or split images because of the fogginess of the lens. So yes, a cataract in certain circumstances can cause ghosting and double visions. It's very easy to diagnose cataracts. We examine the eye on the slit lamp, the microscope, and you can look directly at the cataract and judge the thickness of it and decide how much of the visual problem is due to the cataract. Cataract surgery is actually quite simple and painless. Your eye is numbed so you have no feeling and you have no movement. You get a little sedation and kind of are half asleep, like twilight sleep. The surgery is very quick, 10-15 minutes at the most, and you're up and around right away. Other than needing to take eye drops to avoid infection and help the eye heal smoothly, you're up and around and you can resume most of your normal activities by the next day. We try to stay away from excessively vigorous weightlifting activities, but most general activities you can resume almost immediately, including golf. So you only need cataract surgery when you get to a point in your life where you're not functioning to your own satisfaction. If you feel that street signs aren't clear, that you can't read small print, that you're having trouble on the computer, that you just want to see better, and the cataract is the cause of the problem, that's when you need surgery. And different people have different requirements depending on how active they are. If you're driving at night, if you're playing sports, if you're a big reader and you want to see better, that's when you need your cataract out. If you're doing fine, the cataract is not harming you, you don't have to do anything about it until it's interfering with your lifestyle.